Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, and we are continuing the theme we've had going of shoulder health. Okay, so we've already done 5 or 6 videos on exercises you can do for general overall shoulder health. Today I'm going to show you an exercise for the 4th and final rotator cuff muscles. We've done some for the teres minor and the infraspinatus and the subscapularis. Today I'm going to show one that helps isolate the supraspinatus. Okay, so that's this muscle right in here. And that is the one that tends to tear the most often. Not that that matters, but anyhow, this is going to get that cuff muscle, okay, rotator cuff muscle. All right, so this is scaption. You're going to need a long TheraBand or a tube, okay, because we're going to do both sides, although you could do one side. And you'll just stand in the middle of the tube. And what I'm going to do here, and I'll do it on multiple angles so you guys can see, in order to get that muscle, you're going to go, so here I am in this lateral plane. We're not there. And here I am in this plane going right out in front of me. I'm going to be kind of halfway in between those two. So not all the way at my sides and not all the way out in front, but halfway in, about halfway in between. And then all I'm going to do, thumbs are up, make sure that's really important. And I'm just going to come up to about shoulder height and then back down. Okay? Up to about shoulder height and then back down. Maintaining good back posture, so I'm standing up nice and straight. Chin's in a nice neutral position, or maybe even tucked a little bit. Okay? And I would do 3 sets of 10 to 15 reps. If you are doing sets in a row, three sets of 10 to 15, I would probably rest somewhere between 30 and 60 seconds between your sets. Okay, so this is scaption to 90 degrees. We have other versions of this exercise where we might go all the way up, but it tends to be less provocative if you're only coming up to 90 degrees about shoulder height. Okay, and thumbs up. That is important because it creates a little more space in that joint of your shoulder. Okay, so scaption. So I'll just show kind of multiple angles. So I'll go here. Stand on the tube. Thumbs are up, and we're not all the way at our sides, and we're not all the way out in front. We're about halfway in between. Thumbs are up, and I'm going to come up. Good neck position, good back position to about 90 degrees. So I'm bringing my hands up to about shoulder height. Okay, scaption to 90 degrees. 3 sets of 10 to 15 with a 30 to 60 second rest in between each, 1 to 2 times a day. If you're doing it once a day, it's probably plenty. But you might, depending if you're somebody who does a lot of overhead activity, you might want to do it a couple of times a day. Okay. All right. So I'm Dr. Sam Schroetke here, Physical Therapy and Hand Clinic of Hillsboro with Technique Tuesday, shoulder health, doing scaption with a TheraTube. Like us on Facebook, like the YouTube video, leave comments, ask questions, and we will get back to you. As with anything, check with your physician or physical therapist before trying any of these exercises to make sure that they are appropriate for you. If it hurts and you feel worse when you're done, either do less weight, less resistance, or don't do it. Okay? All right. Thank you.